Hi, I'm Dr. Green. Welcome to MedTwice. Today we're going to do Dr. Green's top 5 birth control options for 2019. The fourth one might shock you. If you like this content, hit that little like button and let us know. Give us a like and we'll know how to plan future content. So let's hit it. What are my top 5 birth control options for 2019? Number 1, Nexplanon, which is the contraceptive implant. You know, there's a reason this is the number 1 top growing branded birth control in the United States. Nexplanon is a really slick little birth control device. It's a little rod that goes in the arm, and it provides birth control for 3 years according to the FDA. And there are some studies that say that it's actually effective for 4 years. But you've got good, reliable birth control for 3 years. So why is this top of my list? Number 1, this has the lowest failure rate of any birth control method on the market. When you think about Nexplanon, when you absolutely, positively don't want to be pregnant, Nexplanon is your choice, which is why I put it in my son's girlfriend's arm. It works. Nexplanon has the lowest failure rate of any birth control method on the market. If you look at the numbers, you're 10 times less likely to get pregnant with Nexplanon than you are with the IUD. And you're 100 times less likely to get pregnant with Nexplanon than you are if you use Depo-Provera or the contraceptive shot. I mean, this thing works well. This is the one birth control method I can give to my patients and tell them that you are not going to get pregnant with this. The really only time that you have to worry about being pregnant is that first week, because you really need to wait a week before it's effective. And if you happen to be on a medication that can decrease the efficacy or the ability for it to work, we have seen some rare pregnancies in that case. But basically, you are not getting pregnant with Nexplanon. And that's what's so phenomenal about this. The other nice thing about Nexplanon is that it's a very simple procedure to have placed, and it's really easy to get out. This thing takes less than 30 seconds to put in. It doesn't hurt any more than, say, getting a vaccine or a shot. It's really simple, safe, and obviously effective. You don't even have to get undressed for this. You really just roll your arm up. And so those are the things that I really like about this. You're not going to get pregnant. It's a no-brainer. You get it in. You don't have to do anything or think about it. And it's really very painless having it placed and also having it removed. Those are some dynamite things about this. Target audiences for this. This is great for teenagers. It's great for those 20-something women. You're in college. You really aren't ready for a kid. Or really any age group where you don't want to get pregnant. The downside is it does make the periods unpredictable, but for most women, they end up having fewer bleeding days, and those bleeding days are lighter than what they're used to. You just aren't going to know exactly when it's going to come. So most people, they have spotting now and then. It's irregular, but generally not a big concern. So that's the great thing about Nexplanon, and that's why it's my number 1 birth control method for this year. Number 2 on the list is the progestin-containing IUDs. There are several of these on the market. Liletta is my personal favorite. But these are IUDs. There's a little T-shaped device that go up inside of your uterus. They have a small amount of hormone called progestin in them, and that keeps you from getting pregnant. These also work extremely well. They have very, very low failure rates, the second best compared to Nexplanon. And various ones last between 3 and 5 years. The Liletta is one I like. It lasts 5 years, but we expect them to get approval from the FDA to go up to 7 years. This is probably going to end up being a 7-year birth control method. Going in does hurt a little bit. You do have a pelvic exam with the speculum, and you have to put your feet in stirrups, and it is crampy going in. But that lasts a few minutes, and then it's over, and now you've got 3, 5, 7 years of effective birth control. Removal really isn't too painful. The other really nice thing about the progestin IUDs is they tend to make people's periods more favorable and make them better. For most women, the periods will either completely go away, which most people like, or they'll just have a little bit of spotting once a month. Generally, you've got to get through the first 2-3 months. That tends to be kind of spotty, but after that, for most women, the periods get either very, very light or non-existent altogether, which is a really nice side effect. So the progestin IUD is number 2 on the list. Again, very effective birth control. It doesn't require the patient to remember to do anything, and it can last 3, 5, 7 years, depending on which one you get. A little investment going in with a little bit of cramping and pain, but then tends to be very nice with very minimal side effects over the lifetime of the device. Number 3, another IUD. This is the copper IUD, also called Paragard in the United States, is the brand of the copper IUD. This is another IUD, works pretty much the same way the progestin IUDs work, but there's no hormone on this. So the really nice thing about this is that there's absolutely no hormone exposure. So for those of you that have had problems with hormones in the past, you've had side effects from birth control pills or from other hormone containing birth control devices, or maybe you have a medical problem where having extra hormones is not a good idea, the copper IUD is a great choice. It's very reliable. It's about the same as getting your tubes tied. It compares with the other types of IUDs, so you're very unlikely to get pregnant. And then it lasts 10 years. So this is a very nice long-term device for those of you that don't want to be pregnant but don't want to be exposed to hormone. Like the progestin-containing IUDs, it does hurt a little bit going in. For some women a little bit, for some women a lot, but it tends to be over in a few minutes. So again, this does require a pelvic exam, like a pap smear, and then it's placed, which can cause some cramping, but generally it's over after that. The one downside of the copper IUD compared to the progestin IUDs is for most women it tends to make the periods a little bit heavier and maybe a little bit more crampy. It tends to be worse in the first 3 to 6 months. Most women say that after about 6 months, the periods sort of go back to the way they were before and go back to normal. But you can have some increased bleeding and increased cramping with the copper IUD. So if you're somebody that's already suffering from bad periods, this may not be your first choice. But for most women, it's very well tolerated. And so again, the big advantage, no hormone, very reliable, and it lasts 10 years. If you can put up with the mildly increased cramping and bleeding with your menses, most women really like this method. So those are 1, 2, and 3. Number 4, here's the one that may shock you: abstinence. Now don't laugh. If you think about abstinence, I told you Nexplanon has the lowest birth control method of any birth control on the market. Not quite true. Abstinence is even better. I mean, if you think about it, it's only failed once in the history of the world, and if you're not from Bethlehem, you're probably okay. You know, the thing about birth control is that we always talk about the theoretical risk of pregnancy versus the practical use of pregnancy. In other words, we can tell you what your chance of getting pregnant is if you use the method perfectly. The problem is most people aren't able to use things perfectly, and so there's sort of a practical method, a practical failure rate. In other words, what's the failure rate in actual use? With abstinence, the failure rate in theoretical use is pretty close to 100%. You just can't get pregnant if you don't have sex. Unfortunately, some people don't seem to be able to figure out how to use this particular birth control method, and they do get pregnant. So abstinence, if not used correctly, has a terrible failure rate, and you will get pregnant if you have sex and are relying on abstinence. By the way, the pull-out method doesn't work very well either, so if that's part of your abstinence, that's not working. But the truth is, if you think about abstinence, if you absolutely don't want to get pregnant, this is the way to guarantee it. Furthermore, you don't have to worry about risk of sexually transmitted diseases if you use abstinence. So for those of you that aren't in a long-term committed relationship, as a physician, I can tell you the safest thing to choose is abstinence. Most people have reasons where that's not their first choice, and that's fine, and that's why we talk about these other methods. But that's why abstinence is on the list. Okay, number 5 may also surprise you a bit, and that's condoms. And the truth is, condoms don't work great as a birth control method, but condoms are very important as part of your birth control routine because they help decrease your risk of sexually transmitted diseases. The other things on my list, apart from abstinence, but the top 3, Nexplanon, the progestin-containing IUDs, and the copper IUDs, all work great at preventing pregnancy, but they don't help prevent sexually transmitted diseases. And so if you're in a relationship where you have some risk of that, you really ought to be using condoms as well as one of those top 3 choices. That will help. It won't completely eliminate your risk of STDs, but it certainly helps decrease the risk of getting a sexually transmitted infection, something that you ought to really consider. If you're relying on condoms as your primary birth control method to prevent pregnancy, you really should use that in combination with spermicide. It really helps decrease the risk of failure, decrease the risk of pregnancy if you use it in combination with spermicide. The problem is it's a bit of a hassle, and I always joke that condoms and spermicide don't work when they're sitting in the nightstand. You actually have to put them into practice. So those are my top 5 birth control options for 2019. Now you may be surprised that birth control pills didn't make my list this year. And there's a reason for that. Although birth control pills are one of the most popular birth control options out there, they're really, in my opinion, not the best because they tend to have a fairly high failure rate. This is one of those things where the theoretical failure rate's pretty good, but actual use tends to be higher because you really have to take the pill every day for it to work. And let's be honest, it's hard to be perfect. And so what happens is people forget to take a pill or two, and next thing you know, they end up pregnant. I'll tell you the scenario I see a lot in my practice. Somebody goes on vacation, they forget to pack their pill pack, and you know how it is. On vacation is when your sexual activity tends to go up the most, and boom, next thing you know, you have an unintended pregnancy. So that's why pills didn't make my list, but they're not necessarily a bad birth control option. Please leave us a comment. Tell me what you think. Are you using one of these top 5? Or do you have a different method that you like? Or do you have questions about birth control? Put them in the comments and I'll try to answer them in one of my upcoming question and answer videos. And if you like this content, subscribe to our channel. We have literally hundreds of informative videos on our YouTube channel that you might enjoy. Thank you.
Medtwice.com